right, connections repaired. Let's welcome back to MidPoint now the Director of Health Policy of the Illinois Policy Institute, Naomi-Lopez-Bauman, joins us. Naomi, I know we were talking a little bit about exactly where this law sits right now in a lot of the language. I had made a couple of statements while you were gone. I wanted to get your opinion. Is it not fair just to say, though, that this law is in so many ways faulty? And as I pointed out, Scott Gottlieb in Forbes.com said that this was the greatest exercise in legislative malpractice simply because of all the language that's in this that still needs to be changed. It wasn't right when they started it, and we're still fixing it to this day. It's a horrible example of how to make a law.
It really is. It's not only not fixable, it's actually very destructive and damaging to the American people. Right now, we are looking at more than 250,000 employers that are going to be directly impacted by the IRS penalties. And those firms employ more than 50 million Americans. We're going to be looking at more than 8 million American individuals subject to IRS penalties. We are seeing workers in the lowest wage sectors of our economy who can least of those individuals who can least afford to be further impacted, basically having their hours cut because the employers are faced with a difficult decision of either reducing their employees' hours or paying very hefty financial penalties. And so this is, and we're also seeing a dramatic increases in health insurance premiums. I know that the Obama administration likes to tout that these premium rates aren't going up as quickly as they were before. But one, that's simply not true in many cases. But secondly, Americans were promised that premiums would be reduced for families by an average of $2,500 per year. We are absolutely not seeing that. We are seeing Americans losing their physicians, not being able to keep their health plan, paying higher deductibles, and in many cases higher premiums. And so really, this law was supposed to reduce the deficit. It's not. It's actually going to increase the deficit. And their projections are already off by about $300 billion. And so we are really in a lot of serious trouble. This law is very damaging and destructive. And these lawsuits in particular give us an opportunity, if the Supreme Court rules in the plaintiff's favor in this King versus Burwell case, to go back to the drawing board and actually deliver on the Obamacare promises of access and affordability, those of which we have not yet seen.
Okay, Naomi, two things I want to get your opinion on here. First of all, you said not fixable. So then, in your opinion, this is not anything where you can take pieces of it out, where you can keep certain pieces and then work on it. You have to basically kill it from the very beginning, destroy it, take it out, throw it out, whatever you want. That's part one. Part two is, if you do that, then what do you do in the interim to create something? Because don't you have to have something that would be immediately ready to take its place?
Well, there are a couple of things. One is, we might get into kind of a game of semantics. I mean, there are some positive things about the Affordable Care Act, like individuals who purchase health insurance on their own can get a tax subsidy or a tax credit. That is actually very positive because if, in the present situation, if your employer doesn't provide it, you're actually paying more for the same health care. And so that's very positive. The idea of private health insurance exchanges is very positive as well. Certainly nothing like what Obamacare has set up, but private health insurance exchanges where individuals can go and shop for health insurance.
So there are some things in here that can be saved.
Sure. There are some things that can be saved. And so, I don't want to get into too much of a,
Sure.
semantic game of, do you have to repeal it? No, you don't have to repeal it. You can keep some of the, a couple of the good items, but you really do have to eliminate things like the medical device tax, things like the employer mandate, the individual mandate, and the risk corridor payments, basically the bailout for insurance companies. And so, there are a couple of things that you can take. So what happens if the Supreme Court rules that the IRS subsidies are in fact illegal going into the states that have not established a state-based exchange? This is a really important question because people do need access to affordable health insurance.
Okay, 60 seconds left here, though. Doesn't this also tell the Republicans, though, and anybody who wants to get rid of Obamacare, you have got to have something ready to go from the first second. You kill it, you got to be able to put something in there because people cannot go without health care.
Absolutely. Now, the first thing Congress would likely do is hold individuals harmless for having these subsidies, and they would probably extend them through the end of the year. I think everyone would be in favor of that. But there are a lot of really great proposals that allow individuals the preferable tax treatment for purchasing health insurance on their own. The Republican Study Committee has numerous bills. They've looked at this in great detail. And now we might actually have the opportunity to have these bills heard in the Senate.
Your opinion, though, that there are plans there? You're confident that something is there? Because there's still a lot of people saying to the Republicans, where's your plan?
Well, the media says that a lot, but those plans are there. The Republican Study Committee has been working very hard on evaluating all these plans. There are really great ideas on our side of the aisle, and that would actually deliver on health care access and affordability. Those promises that were made by Obamacare, which have not been delivered and will not be delivered.
All right, that's going to take up our time right here. Naomi-Lopez-Bauman, thank you so much for your time and your comments. I'm sure we're going to be talking again very soon.
Thank you.
All right, short break and back as we go around the dial and go head on with the president and his executive order immigration policy. And at 51 minutes after the hour, the current and one former president graces the Sunday shows with more than a few interesting remarks on their job and, for one, on his brother. It's coming up right here on MidPoint.